Thank you, Joan. You're just listening to you there. Like what struck me was that your genuineness and heart shone through so strongly. And your story is a highly personal one from 2005. As you say, it's a 10-year story. And your colleague's advice of go with the flow seems to have worked for you. You certainly had a lot of flow to go with over that 10 years, a lot of personal journey to go through. And even in 2010, when it came back again, and as you called it so nicely, the little bugger returned, right? Your spirit still shone through. You say that you're lucky to be here today. I think we're also lucky to have you here today to tell the story, because it's one of inspiration and one of honesty and openness and kindness, and one of those ones that, you know, it's very difficult not to have the heartstrings plucked when you're hearing someone talk so honestly and so openly, and for that I thank you. The Brave Hearts Choir, by the way, while ye meet in UCC, the Galway crew meet in the G Hotel, right, as they told us in Galway last November. Nothing against UCC, but by God, the G Hotel is fairly posh. So you'll have to go up there, I think, and have a little exchange programme between yourselves and the Galway crew. Okay, so our next speaker is going to speak about coping with an ovarian cancer diagnosis. It's Sarah Anglim. She's medical social worker in the radiation oncology in St Luke's Hospital in Dublin. She completed her Bachelor in Social Studies in TCD in Dublin. Sarah has a special interest in gynecological cancers and has worked in St Luke's for over 3 years now. We're actually delighted to have Sarah here today to take us through her presentation. So Sarah, you're very welcome. So we'll get this up and running.
Thanks very much for having me today. As Brian said, I work in St Luke's Hospital. I have quite a lot of experience in working with ladies with gynecological cancers that would have been coming to St Luke's for radiotherapy. So I have that experience, and I based my presentation today on some kind of evidence-based research. So that's kind of where I'm going to go with it today. Oh, sorry. Yes, of course.
See, Sarah, down here, we shout out the word. You see, we don't. You're all so nice above in Dublin and so on, right? Take a leaf from the fellow Dub over there who needed no microphone earlier on to get the point across loud and clear. So if you want to come in a bit, we'll just check it and see.
Okay, is this a bit better? Oh yes, I can hear it myself now. Okay, great. So basically, it's impossible to cover coping with an ovarian cancer diagnosis in a 30-minute slot. So these are just a few of the things I wanted to focus on. So the social and psychological needs of women with ovarian cancer, the lived experience of ovarian cancer surgery, body image and cancer, cancer treatment and sexual health, physical activity and improved quality of life, and self-management for women with ovarian cancer. Okay, so first of all, looking at the social and psychological needs. So in supporting women with ovarian cancer, it's very important to address the effects on the psychosocial health and well-being. Okay, quality of life, social support and relationships, self-image and sexual functioning, distress, personal growth and coping are the psychosocial health issues to be addressed. Several factors are associated with improved quality of life, such as supportive relationships, currently not being on treatment, and having fewer physical symptoms. Some women reported spirituality helped them with their cancer experience and with maintaining hope. Pain was found to be significantly correlated with fatigue and depression, and this could remain with women going forward. Younger women with ovarian cancer had higher levels of distress and depression compared with older women. That was just found in this study. And then younger age of diagnosis was also associated with better physical functioning. So then looking at social support and relationships. Greater social support is related to higher self-esteem, decreased depression and anxiety, and overall good health for women with ovarian cancer. It was also found that women need peer support from other women experiencing ovarian cancer. They'll understand the physical and psychological challenges, as loved ones often have difficulty comprehending a cancer diagnosis themselves. Support groups offer an opportunity to share symptom management techniques as well. So women with ovarian cancer reported stronger, more positive relationships with significant others as compared with a control group. Therefore, support services incorporating husbands, partners and children and access to other patients are vital. So looking a little bit here at self-image and sexual functioning, and I actually go into it in a little bit more detail later on, just some things that were identified, and I know Dr. Coulter mentioned as well, abdominal scars, hair loss, weight gain and prophylactic procedures that remove organs that are symbols of female identity among women. Women experiencing significant physical changes impacting on their self-image may perceive less control over their illness and treatment. Chemotherapy and surgically induced menopause can result in vaginal dryness, painful intercourse, fatigue, and decreased libido. And I think these are just some of the things that, we need to have a conversation about. Okay, so then looking at psychological distress and functioning. A period of great distress, of course, is at diagnosis. It's an abrupt transition from healthy woman to cancer patient. It can elicit feelings such as loss of control, fear and uncertainty for the future. Women reporting higher levels of optimism at the start of their chemo, they reported lower levels of distress. Physical symptoms can result in lower functioning and impaired ability to complete daily activities. So then looking at personal growth and coping. Despite the challenges women face, they often experience personal growth through the personal relationships and renewed perspectives on life due to the illness. Through their losses, many women discovered new personal beliefs, being active, travelling, and increased quality time with family and friends, supporting other women with ovarian cancer, participating in advocacy, maintaining a positive attitude, living for the moment, and focusing on the future were important coping techniques that were kind of highlighted in this study. There are inherent assets women have strengthened by the cancer experience. I think that's something really interesting to look at. By having this illness and going through this, it changes you, and you see that you have these strengths that maybe you didn't realize you had. Okay, so I wanted to look a little bit about the surgery aspect, because I know that this is one of the kind of main and first treatments for this type of illness. So in this study here, they looked at kind of how women prepare themselves for surgery. And they found that women kind of intuitively prepared themselves for their diagnosis and treatment, and that their ability to prepare is influenced by a range of factors such as personal lifestyle, social conditions, their own coping strategies, and their experiences of hope. Ability to prepare can be strengthened by providing information and psychosocial support. So I think those things are important, information from your medical team, but also to have the psychosocial support from family members, from friends, and sometimes from healthcare professionals such as the clinical nurse specialists, or if there's a social worker on the team as well. So recently diagnosed women experience psychosocial and physical health problems caused by the disease and the treatment. And psychosocial support improved the post-operative quality of life and general health. Good coping skills positively influenced quality of life and survival. So these were just some of the things that came out of this study that they found. They used a quote, hoping for the best, preparing for the worst. The diagnosis and the start of treatment was an extensive life event where personal existence was threatened, although hope for a cure and to live were present. They also coined this phrase, naive understanding, when women intuitively prepared themselves, even if they were uncertain about what they should be preparing for. Worries included risk of developing complications during their surgery and potential side effects of chemotherapy. Women reflected on having a life-threatening diagnosis, receiving chemotherapy, being cured, fear of recurrence, developing complications or side effects. Great confidence in the skills and judgments of the healthcare professionals were expressed, and many women found that really helped them in their cancer journey. So then, preparing as action. They had two concepts, preparing as action and preparing in interaction with others. So making practical arrangements, such as making sure the house was ready for recovery periods. This was a kind of a coping mechanism that some women found that were helpful. And it was found as well that women who had fewer social resources expressed strong feelings of loneliness and uncertainty in the period after their surgery. Creating disease-free zones was another significant coping strategy that was kind of coined here. So that's about occupying yourself with activities that have nothing to do with the illness or the treatment, focusing on areas where the disease had no impact on. This is how women fight back against disease from invading the healthy areas in their lives. Maintaining everyday life, that's another coping strategy. Sustaining some normality in a period of great uncertainty. Women were aware of the gravity of their situation while they still engaged in normal everyday life. So then the way that the women kind of prepared in interaction, that's in kind of conversations. So it can be difficult and exhausting repeatedly passing on news to others, such as, I have this diagnosis, I have this treatment plan. But it also helps perceive the situation on a deeper level. Like, the more you talk about it, the more you get yourself used to the idea of it, and that in itself can be therapeutic. So interacting with healthcare professionals, and this can be to gain influence, and that was of a major importance to some, and others left decisions to professionals, asked for advice and things like that. Receiving basic care and support from professionals had a very positive effect on women's well-being. Family relations. So it was found that partners could support and reduce anxiety, but that women also felt that by being ill, they were causing concerns and worries to their families. So there was the double with that one. And reflections and experiences. So some of the kind of reflections that women would have had, it would have been about their self-image. And they would have felt kind of that they were feeling weak and strong at the same time. That was a constant topic. A positive outlook was important in relation to quality of life. And that diagnosis and treatment influenced the woman's whole lives, and not just merely their physical bodies. So then they kind of look at life and death, and the commonly shared understanding that the disease did represent a threat to life, and there's a strong focus on keeping oneself alive and not expressing fears of death. So then I just develop the surgery a little bit more in this slide here. So here they looked at a kind of putting in a plan for women, and the objective was to describe and evaluate health and coping for women undergoing their surgery, and to develop a support program for health promotion, to see if that kind of gave better quality of life outcomes for women post-surgery. And they defined health in 8 areas: physical functioning, limitations due to physical conditions, pain, general health, energy, social functioning, limitations due to mental conditions, and mental well-being as well. And then the program included specialist management of general health, basic care and support. So support dealt with undergoing surgery for cancer. Anxiety and insecurity were induced by the illness as well as the surgery. To reduce anxiety and to support coping, individually adjusted information was initiated at the first outpatient visit, followed by nurse-led phone calls. Written and visual information on the illness and treatment were provided as well. So the people in this study experienced deterioration in their physical health while they were having their surgery and recovering, but they had an improvement in mental health in the period of time from pre-op to post-op. So they found that basically ongoing psychosocial support during the full treatment period for all women seemed to be well justified here. Okay, so I said earlier on that I just wanted to develop the kind of the areas of body image and sexuality a little bit more, because it was like a little bit how Dr. Coulter said that sometimes it's not always spoken about, and then sometimes people don't bring it up. But I think it's a real thing for everybody. It's a real issue. So by looking at body image there, we all try to influence the way we look. Exercising, gaining or losing weight, makeup, hair dye, clothes. The body is easily changeable and it reflects our identity. The kind of whole concept of body image began in the 1960s, and the emphasis was on eating disorders. And then it kind of looked at not seeing yourself as others see you. So an example would be maybe women with chemo-induced hair loss experience this as a loss of womanhood and associate it with sickness and death, and therefore use wigs and makeup to minimise the changed appearance. And that's a really good coping mechanism there. The thing with body image and the conversation about it is that people don't generally want to come across as being overly concerned about their appearance, and it makes it difficult for patients to talk about what they're going through. And a lack of communication about appearance is kind of a socially accepted norm. So looking at kind of cancer and the body, cancer treatment and side effects all interfere with the body. Bodily changes in relation to the specific cancer site and symptoms attached to that. Psychosocial concerns influence the way in which the body is perceived. The feeling of losing one's attractiveness can be seen as a threat to intimate relationships and challenge to the female identity. So some of the possible interventions here could be setting the issue on the agenda, whether that's in a conversation with your nurse, in a conversation at home with family or friends, establishing a relationship on the team of medics that you're working with, trust between your nurse and yourself to talk about any issue and tell your story, to give yourself time for reflection on these changes, and to ask questions about physical changes and possible physical changes. So next I'm just going to look at cancer treatment and sexual health. So healthy sexual expression can affirm love, relieve stress, anxiety, foster hope, accentuate spirituality, and distract from the emotional and physical aspect of the illness. Maintaining sexual health along the trajectory of cancer treatment can be difficult because of the complexity of communication surrounding the topic. And many investigators have evaluated sexuality concerns in relation to quality of life. So sexual dysfunction for cancer survivors may result from various treatments: surgery, radiotherapy, chemotherapy, or hormone manipulation. Patients indicated that they did not initiate conversations as they thought healthcare professionals were too busy, they didn't want to bother them, they thought that they should just be grateful to be alive, or that they thought sexual health was a private matter. There can be a lack of communication, resulting in a conspiracy of silence on this matter. So women reported they wished they had been better informed about what to expect so that they could have been more proactive in sexual health maintenance following their treatments. Cancer and treatment can lead to sexual and reproductive dysfunction, loss of self-esteem, and disruption to supportive relationships. Anticipation of these concerns can sometimes alleviate some emotional suffering. Normalising concerns and answering questions help empower women to maintain their sexual health. And again, like the doctors mentioned earlier on, Oncology nurses have been at the forefront of advocacy for attention to sexuality and overall quality of life. Expressions of love and closeness are a human need, and that's throughout the illness trajectory. The impact of ovarian cancer treatment on sexuality begins obviously with the surgical removal of the uterus and ovaries, and sometimes followed by chemotherapy. Regardless of age, women reported that ovarian cancer treatment had an impact on their sexuality, and the changes made them feel no longer whole. Regardless of age and relationship status, sexuality is altered by the diagnosis and treatment of ovarian cancer. It was found that younger women were more likely to report a negative impact on their sexuality following their diagnosis. So sexuality is a highly personal construct, with meanings derived from culture, religion, ethnicity, and life experiences. A lot of sexuality research is limited to function and satisfaction, but it's a multi-dimensional concept, and it should include communication with intimate partners, relationship quality, and perception of one's femininity, as well as the functional aspect. So lots of side effects can influence it as well. Fatigue, nausea, vomiting, weight loss, weight change, loss of libido, loss of hair, all side effects from cancer treatments. And these poor body images can affect your sexuality, of course. So women define sexuality as how they felt as women, including their figure, clothing, how they present themselves to others. As a group, women define sexuality in terms of being defined as a woman, touching, talking, and ability to fulfill sometimes traditional responsibilities. It was another quote was, feeling good about yourself, feeling attractive. And the psychological influencing factors: perception on the effect of the surgical scar, presence of the implanted port for chemo, hair loss. A focus group also mentioned symptoms of menopause, and distress over changes in sexuality were expressed more in relation to daily experiences, especially hair loss and fatigue. The ability to engage in exercise had a positive impact on participants and led to a positive sense of self. In the focus group, women described exercise such as walking, yoga, or gardening as a way to cope with changes in yourself. The presence of a significant other and the quality of that relationship, along with previous sexual concerns, had an influence on the degree of distress caused. So I wanted to just look briefly at physical activity and its link with improved quality of life as well. So the evidence shows that psychological distress in cancer patients is vast. And research has found a positive association between physical activity and quality of life in women with ovarian or gynae cancer between 2 months and 20 years after diagnosis. And the benefits of physical activity may be greater for those on chemo, because this is when women may experience heightened levels of psychological distress, but the aggressive treatment following diagnosis is likely to reduce women's capacity for physical activity. So it's hard to weigh that up. You have to be able to feel like you can do it at the time as well. It's unclear if exercise is effective in reducing distress among women who may have poor physical function anyway, so that's important to note as well. And it was found that women who maintained or increased their physical activity after diagnosis had better quality of life scores than women that decreased their activity or remained inactive. So exercise has been shown to be effective for increased functional capacity and relieving fatigue, anxiety and depression, and that's in a number of cancer groups. Maintenance or increasing activity from before to first year post-diagnosis was associated with better outcomes. Women who remained inactive had the worst depression and quality of life outcomes, and it suggested that activity may improve psychological health during treatment and non-treatment phases. For women with ovarian cancer who frequently live with advanced disease, experiencing repeated lines of chemo, taking up or maintaining physical activity may be important for establishing and preserving well-being. And finally, I just wanted to have a look at self-management. So the ways in which women themselves can self-manage and be their own support. So self-management is daily, interactive and dynamic process. It involves problem solving, goal setting, decision making, resource use, partnerships, action planning, self-tailoring. And if you look at transitions, these are movements between two stable periods of time. And there can be many transitions when you're undergoing treatment for ovarian cancer. There are times of vulnerability to risks that may influence health and well-being. Challenges include uncertainty, fears, lack of control, affecting lives, relationships and families. So how do we participate in self-management? Women wanted to self-manage, to have a sense of control over what was happening to them and to be their own advocate. Understanding their cancer treatment and what to expect over time helped women maintain a sense of control over what was happening to them. They talk about taking it one step at a time. In this study, women took a short-term approach to managing their care, dealing with the immediate need instead of the long-term approach. And this would help them not become overwhelmed with uncertainty or anxiety or too much information. Okay. So they talk about how transitions are challenging steps. Diagnosis, surgery, recovery, chemo, managing symptoms and perhaps recurrence. Emotional transitions such as anxiety, sadness, uncertainty can hinder self-management from time to time. Women sometimes delegated self-management to others when they struggled with physical and emotional transitions, and this was found to be quite a good coping technique. Women reported trusting relationships with their doctors, but at times time constraints and problems negotiating the healthcare system inhibited their self-management. Communication with doctors was seen as very important to obtain information, weigh decisions and get reassurance. Empowerment was a key factor in self-management. Some women found it difficult to self-manage if they hadn't found their voice yet. Early introduction to palliative care can provide ongoing support to women with ovarian cancer as they contemplate their goals for living. So, in summary, with the step-by-step approach, multiple transitions arise. Women focus on the transition they perceive as most important and then go from there. Thanks very much.
Thanks, Sarah. You certainly highlighted all the key aspects of coping with a cancer diagnosis, and all too often we think it's about the surgery and the chemo, but there's just so many other things involved. That you've certainly given us some great ideas and some good food for thought. I'm about 2 years ago, I remember doing some of this, and I kind of said, well, we have to have an IT break. Because I had to check the computer to get ready for the next speaker, and someone said, what a great idea, we're going to have a tea break, right? So we are actually going to have a tea break, right? Because I have to have an IT break. So we'll have tea outside in about 2 or 3 minutes, right? So because I have to set up the screen for our next speaker. So if you want to grab a cup of tea, by all means do, and you can bring it right back in with you again. So, okay.